Chest pain. Your heart is beating very fast. You are almost certain you are having a heart attack. You rush to the emergency room. An ECG, blood tests. A few hours later, the doctor tells you, you are not having a heart attack. But if it is not a heart attack, why does the pain feel so real? Why are you still short of breath? And how do doctors know that it is anxiety and not a heart attack? That is exactly what we are going to explore in this video. Part 1. Why can anxiety feel so much like a heart attack? To understand this, you first need to know how your body's alarm response works. When your brain senses danger, it immediately activates survival mode. Stress hormones are released. Your heart beats faster. Your breathing becomes more rapid. Your muscles tighten. Your body prepares to fight or flee. This is a completely normal response when there is a real danger in front of you. But in people with an anxiety disorder, this alarm system can be activated even when there is no real danger. As a result, your heart keeps racing. Your chest feels tight. You still feel short of breath. You may start sweating. Your hands may shake. You may feel dizzy or feel like you are about to faint. The frightening part is, these symptoms are completely real. You are not imagining them. The problem lies in how your brain interprets these signals. When your heart beats faster, your brain may think your heart is in danger. When your chest feels tight, your brain may conclude that you are having a heart attack. The more afraid you become, the more you focus on your body, the more attention you pay, the more aware you become of every heartbeat, every breath, every small ache. Your brain becomes even more convinced that danger is present, and the alarm response continues. A vicious cycle begins. The symptoms create fear. The fear makes the symptoms even worse. That is why so many people believe they have heart disease, when the real cause is actually an anxiety disorder. Part 2. How do doctors evaluate you when you arrive at the emergency room? The first thing doctors need to determine is whether you are experiencing a dangerous condition that requires immediate treatment. That is why they do not reach a conclusion based only on your chest pain. The doctor will ask, when did the pain begin? Did it start while you were resting or while you were physically active? How long has the pain lasted? Does it spread to your arm, shoulder, jaw, or back? Do you have shortness of breath, nausea, cold sweats, or fainting? Next, the doctor will assess your risk factors, such as a history of heart disease, high blood pressure, diabetes, smoking, or a family history of heart disease. After that, you will have a physical examination. Your blood pressure will be checked. Your heart rate will be measured. Your blood oxygen level will be measured. And if necessary, the doctor will order an ECG, blood tests, or keep you under observation for a period of time. The purpose of all these steps is to answer one question. Are your symptoms caused by a dangerous heart condition? Only after life-threatening conditions have been ruled out will the doctor consider other possible causes, including an anxiety disorder. Part 3. What does a normal ECG mean? Why do doctors still order a troponin test? Many people think if the ECG is normal, then their heart must be completely healthy. But in reality, an ECG is only one part of the evaluation. It records the electrical activity of the heart and helps doctors detect many important abnormalities, including changes that may occur during a heart attack. However, not every heart injury appears on the ECG right away. That is why doctors often order a troponin test as well. Troponin is a protein that is released when the heart muscle is damaged. If a heart attack has occurred, the level of troponin in the blood will usually rise. When the ECG is normal, the troponin level is also normal, and your symptoms do not suggest an acute heart condition. The likelihood of a heart attack is much lower. In some cases, doctors will still repeat the test a few hours later, because if the injury has only just occurred, troponin may not have risen during the first blood test. Additional monitoring does not mean the doctor missed something. It is done to make the evaluation more accurate. That is also why Doctors never rely on a single test. Instead, they combine your symptoms, the physical examination, the ECG, blood tests, and your overall clinical picture to reach a final diagnosis. Part 4. When should you go to the emergency room, and when should you consider anxiety? This may be the most important takeaway from this video. If you have severe chest pain that does not go away, severe shortness of breath, fainting, or any new symptom that has never been evaluated by a doctor, seek medical care immediately. Do not assume it is just anxiety. Life-threatening conditions should always be ruled out first. But if you have already been examined by a doctor, had the necessary tests, and have been told that you do not have a dangerous heart condition, then repeating the same tests over and over again usually will not resolve your fear. What matters more is treating the real cause. If the cause is an anxiety disorder, it can absolutely be treated with psychotherapy, medication when appropriate, and lifestyle changes. The goal of treatment is not to make your heart stop racing forever. It is to help your brain stop misinterpreting every rapid heartbeat as a sign of a heart attack. When that happens, you can gradually break free from the vicious cycle of symptoms, fear, and repeated medical testing. Ending. If there is one thing you should remember after watching this video, it is this. Anxiety and a heart attack can feel remarkably similar. So similar that even the person experiencing the symptoms may find it almost impossible to tell the difference. So, never assume that it is just anxiety. Always let a doctor rule out dangerous conditions first. But there is one question that still troubles many people. After being examined, having an ECG, having blood tests, and being told their heart is completely healthy, why can they still not stop worrying? Why is a single fast heartbeat, a brief episode of chest pain, or a moment of shortness of breath enough to convince them they have a serious illness? That is exactly what we will explore in the next video. Why do you still believe you are seriously ill, even when all of your test results are normal? Thank you for watching. Don't forget to like and subscribe to the channel. Check out my other videos to learn more useful tips about medicine and health.